Pregnancy is a fascinating experience for everybody. When a woman is pregnant, people feel it's just the woman, but on the contrary, when a woman is pregnant, it's like everybody around her is carrying that pregnancy. The woman, her partner, her family, her friends and associates, including her doctor. So that makes it a fascinating experience for everybody. Now, pregnancy is not a disease condition at all. It's just a physiological change that has taken place in the body of a woman. Majority of women will not have any problem at all because it's just minor changes that have taken place in the body. Pregnancy symptoms vary from one woman to another. In some women, it may be mild, while in some, it may be exaggerated. But as the pregnancy progresses, these symptoms will just go away and the woman begins to have smooth time. Again, there are certain changes that must take place in the body of a woman so that she can accommodate that baby. These changes are compulsory. Without them, you can't have a successful pregnancy. And the changes can be physical, biochemical, anatomical, and even emotional. So these are what is responsible for all the behaviors that pregnant women exhibit and all the symptoms that they have. For instance, towards a pregnancy is you suddenly stop seeing your period. There is cessation of milk. From there, you start having breast fullness and breast tenderness. Then you have this feeling of wanting to throw up. You feel bloated. There are changes in your skin. Before the tummy now starts coming out, protruding, you notice you are passing urine too frequently. And finally, when the tummy is not protruding, you have loss of appetite, you have cravings for some things, you don't have cravings for anything, the normal activities you usually do, you are not interested, or suddenly you are not interested in something that you never had interest for. For some women, some are overtly excited, they are usually happy. Why for some? Oh my God, this is the period that their husband will just take off and leave the house. She becomes excessively troublesome. These are normal changes. So if you know about these changes and you happen to be around the women during this time, you'll be able to cope with them and help them grow through this phase in their life. Pregnancy is divided into 3 phases. You have the first trimester, second trimester, and third trimester. First trimester is the first 13 weeks of pregnancy. Second trimester is from 14 weeks to 28 weeks. And third trimester is from 28 weeks till 40 weeks, 41 weeks. According to the trimester, there are different complications that can arise. So, I will now take you through the trimesters so that you will know what to expect at every point in time.
You mentioned something that when a woman is pregnant, she should not be seeing her period.
Yes.
One sign is that period ceases. Now, this stuff you mentioned is very important because on social media, I have seen so many ladies that when they were pregnant, they were still seeing blood. They were still seeing their period.
Now, that is one of the major signs in pregnancy.
Go on, ma. Please throw light on that, ma.
Bleeding at any time in pregnancy is a danger sign. There are certain reasons why a woman will bleed, and this varies according to the trimester. In the first trimester, during the early course of the pregnancy, when the fertilized ovum is looking for where to stay inside the uterus, it kind of digs a hole, which we call implantation. During this process, there is slight bleeding. It is not heavy. So most of the time, the women will feel that it is their menses, and this results in wrong calculation. Because when you now ask them, they will say, hey, actually, I saw my period, but it did not flow like it used to. Do you get it now? So that one is implantation bleeding. Again, there's what we call threatened miscarriage. The pregnancy is trying to stay, but there are certain things in the woman's body that is still trying to fight this pregnancy, be hormonal imbalance, or the endometrium where the baby is implanted is not really ready for that baby. So this may result in some bleeding which you'll be experiencing along the line, but usually this bleeding is mild. So some of those women will not tell you that I bleed every day, so I'm bleeding and I'm also pregnant. Now, the level of blood loss is what determines if an urgent action will be taken or not. Again, starting from very early in the pregnancy, during that period, like I told you, there are changes that occur in the woman's body. For instance, in the vagina, there is increased blood supply. So any little injury can result in bleeding. So sometimes these women, I have seen so many cases, they will tell you that actually this bleeding just started after they had sexual intercourse with their partner. So some can be a mild laceration that will bleed for a continuous time until it seals up. So coital laceration can be a cause of bleeding in early pregnancy, or in fact throughout the course of the pregnancy. Then threatened miscarriage can also be a cause of bleeding. Again, if it is a failed pregnancy, she can start to bleed. That means the pregnancy is not viable. It's telling you that the body is trying to get rid of it. Again, there are some conditions that can exist which may only manifest during the course of the pregnancy. One of them is cervical cancer. We have had issues of women with cervical cancer getting pregnant. She may not know she's pregnant, and there is a mass lesion on the cervix. Once it is touched, she starts to bleed, and then she says, I'm bleeding in pregnancy. So you have systemic causes of bleeding and local causes of bleeding. Or in all, any bleeding in pregnancy is a danger sign. It's a red flag and should not be treated with levity.
Now let's go to the first trimester. What are those signs that a woman would see in the first trimester, the first 13 weeks of pregnancy, that is a danger sign?
Number one, bleeding. Bleeding at any point in time should be taken seriously. Like I said, pregnancy is a fascinating experience. Most times, no complaint. So when you notice you are bleeding, please come to the hospital so that you can be evaluated by your doctor. Another warning sign. Normally, pregnant women experience what we call nausea and vomiting. It's as a result of the pregnancy hormones that are elaborate, they are excessive. This nausea and vomiting often worse in the morning, but can happen at any point in time during the day. It can happen in the afternoon, it can happen at night, but it is worse in the morning because the level of that hormone is highest in the morning. Now, so pregnant women will say, I do not vomit, I do not have nausea. It's fine if you don't experience it. Some will say, I always experience it. It's also good. In actual sense, women who have nausea and vomiting, it's a good sign. It tells you that that pregnancy is doing very well and the pregnancy is going to have a good outcome. But anything that happens in excess is for worry. When you now notice you are not vomiting excessively, you are not tolerating anything again, this has resulted in weakness. You are weak. There is no strength. Anything you put in your mouth comes out. Please and please, it is time to seek urgent medical attention, because excessive vomiting in pregnancy is what we call hyperemesis gravidarum, because it is associated with fluid and electrolyte imbalance. In rare cases, it can result in disaster for the woman. So she needs to come to the hospital.
Like what?
So that they will check.
Like what disaster for those?
Yes, so that they will check what is the cause. Like I said fluid and electrolyte imbalance. When you are not taking anything again, the body will now look for how to get glucose. And one of the ways the body gets glucose is looking for glucose from non-carbohydrate precursors. It starts to. So by the time you check her urine, that is the first thing we know that this is urgent. Pregnant woman comes and complains, I have been. The first thing you do, we say check her blood sugar. If the blood sugar is low, it means there's a problem. Then check her urine. Once you see ketone in the urine, it means she has reached the stage we call starvation. Then you will check other electrolytes, sodium, potassium. When you check these electrolytes and they are also deranged, it means something needs to be done to help this woman. It can get to a stage where you vomit too much. It can lead to some mental conditions too. So you have to attend to such women urgently by admitting them, replacing the lost electrolytes, and giving her medications to stop the vomiting before she's allowed to go home. Oftentimes, if it is normal, not due to any other pathologic condition, as the pregnancy progresses, it will stop. But there are also some conditions that can cause this. One is thyroid disorder in pregnancy. It's very bad. It can result in the death of the woman. Another one is if the woman is carrying multiple pregnancy, twins or triplets, it's a big problem. Then a third cause is if this woman is diabetic. Just imagine a diabetic patient vomiting excessively. Vomiting excessively. You should know that in fact that woman can become unconscious. So you need to urgently take care of her. Again, we have some conditions that mimic pregnancy, but they are not in actual sense real pregnancy. An example is a molar pregnancy. And in molar pregnancy, you have exaggerated hormones. So the woman starts to vomit too much. So that may just be a pointer that this pregnancy is suspicious to her. Now that is for vomiting and nausea. Another danger sign in early pregnancy is pain during passing urine. Normally, early stage of the pregnancy, you will notice you are passing urine frequently. You don't have to worry. It's normal because the uterus is still in the vagina. So with the baby's weight, developing baby, it is just on top of the bladder. So any little water you take, you go to the bathroom. You want to go to the bathroom, it is okay. It's normal. When you now notice you are going to the bathroom too frequently, there is associated pain when you pass urine. It then tells you that there is an infective condition going on, and that is a danger sign and warrants medical attention. Another condition is when you have elevated body temperature, which we call fever. You touch your body is hot. Now, some pregnant women will tell you, normally, I feel hot when I'm pregnant. Yes, this is because there is increase in the basal metabolic rate in pregnancy. And one of the hormones that are elaborated during pregnancy will cause the woman's temperature to rise just a little. So when you touch pregnant women compared to a woman who is not pregnant, she feels warm, but it will not get to the level of fever. Warm to touch, different from fever. By the time she is febrile, it means there is an infective process going on. And if you are in Nigeria, topmost on the list is malaria. And we all know the complications of malaria. We all know the complications of urinary tract infection. So, such a patient needs urgent attention. Another danger sign in early pregnancy is headache. For some women,
Headaches.
headache. For some women, they may not know that they are even hypertensive. But as soon as they get pregnant, they now start having this persistent headache. So that may just be the first thing that will bring them to the hospital. And you just check and see that the blood pressure is elevated. So generally, the first trimester doesn't really pose much of a challenge to the woman, because the adaptation that needs to take place in the body is still taking place. It has not completely finished its work. The danger signs in first part of the pregnancy are not so much. Another one is for women who have a problem with the cervix. These are the women that are prone to miscarriages. They notice this unnecessary fullness in the vulva. They will tell you, doctor, I said there are some women that are prone to having miscarriages. This is because the neck of the womb is loose. So one of the signs they may experience in the early part of the pregnancy is this feeling of fullness or heaviness. They tell you, doctor, I feel a load in my private parts. Pressure symptom. So she needs to come to the hospital. By the time you just take a look at the cervix, you will see that the cervix is open, meaning she's having a miscarriage. So such symptoms should not be taken lightly. Those are basically the signs in the first trimester. There's another very important one in the first trimester. That is when you know that is this pregnancy in the normal location or is this pregnancy in an abnormal location. One of the feared complications is when the pregnancy is outside the uterus. For the woman, she may not even know God has answered my prayer. She's happy. And when she doesn't come to the hospital, it may be in the cervix, it may be in any other location apart from the uterus, and continues to grow. Pregnancy. And the only sign she may get is depending on the level of severity. The ectopic may be unruptured, it may be ruptured. If it is unruptured, don't say I'm having pain, lower. That will not prompt the doctor to say, okay, let us confirm the location of this scan and